ankylosing spondylitis, but I'll be limiting myself to only the signs and symptoms. Ankylosing spondylitis is an autoimmune disease, a seronegative spondyloarthritis affecting the sacroiliac joints and vertebrae. But before moving further, let me drop this here, that once we pick an autoimmune disease, we have to check out for other possible or just additional one autoimmune disease on top of that. Meaning, the presence of an autoimmune disease means you might have more than one autoimmune disease in that individual. Okay, let's move on. Ankylosing spondylitis affects entheses, that is the size where tendons or ligaments are inserted into the bone, leading to the inflammation of the entheses, meaning enthesitis. There will be osteopenia, where the bone mass or density will be lost. But before we get there, erosion would have occurred. Then there will be loss of bone density. Ossification will also take place because later on new bones will be formed. But the hallmark of ankylosing spondylitis is syndesmophytes. Syndesmophytes is another way of saying osteoproliferation. Here, the spinal ligaments will produce bony outgrowth that will be crossing and forming bridges across the vertebrae. The vertebrae will then form a bamboo appearance when they become fused together, and that will lead to less flexibility, rather rigidity. And once we pick that, we can tell that this is ankylosing spondylitis, although it can occur in other arthritis conditions. But if you are suspecting ankylosing spondylitis and you pick that, you are still on the right path. Epidemiologically, it affects more male than females at ratio 3:1 respectively. And also it favors female the more, besides the fact that less female will be affected compared to males. The affected females will have less trouble, so they have milder situations. HLA-B27 is occurring in about 90 to 95% of patients with ankylosing spondylitis. The onset of this autoimmune condition is at young age, as young as age 20. The size that will be affected the most will be sacroiliac joints, the hip, spondylitis, that is vertebral inflammation, and the shoulder. Clinical features. The first part of the clinical feature will be morning stiffness that will be greater than 1 hour. Then the individual will complain about back stiffness, pain at night, the buttock pain that will be continuous in nature, pain at the sacroiliac joint, decreased range of motion, positive scuba test, and positive modified scuba test. Postural changes. That will lead to increased occiput to wall distance, increased vertical flexion, increased thoracic kyphosis, and decreased lumbar lordosis. Other features will be antler to axial subluxation. Here, the ligament will become lax, so ligament laxity, leading to dislocation of the atlas and axis, and then, disfiguration in that region. Large joint arthritis of the lower limbs will be the case, enthesitis of the tibial tuberosity, enthesitis of Achilles tendon and plantar fascia insertion into the calcaneus. And the individual can be battling with caudal equina syndrome. Now let's check extra-articular manifestations of ankylosing spondylitis, meaning outside the joint. Where can we pick the signs and symptoms of this autoimmune condition? Within the heart or outside the heart? The aorta could be affected, giving us aortitis. We can have aortic incompetency and aortic regurgitation. Within the eyeballs, can have anterior uveitis, gastrointestinal tract with ulcerative colitis, the lungs with apical lung fibrosis. The kidneys and the brain could be affected with amyloidosis, giving us dementia. And the surrounding of the heart could become inflamed, pericarditis, and we can have arrhythmia from conduction disturbances, and there may be heart failure, including IgA nephropathy. With that, I've come to the end of this short presentation. So, ankylosing spondylitis could present with this besides the vertebrae and the sacroiliac joints affectation, including some other large joints as well. Thanks for listening. Remember to subscribe to my channel. Remember to send this to all your friends on your platform. I appreciate that.